Sleep apnea is a very serious breathing condition in which people have a blocked airway and they stop breathing during the night for short periods of time. The main solution is we have to get the blockage from the airway, and typically that blockage is the musculature around the head and neck. So some solutions to it is a very simple breathing device that actually moves the lower jaw forward and pulls the muscles away from the airway so that you can get a full, continuous breath of air and not have that blockage during sleep. Snoring is when there is a partial blockage of the muscles over the airway, and as the air is forced through that blockage, it vibrates on the muscles and causes the snoring sound. Sleep apnea is a much more serious condition than snoring. Snoring is just a partial blockage of the airway, but air is getting through, and it vibrates off the muscles and makes the snoring sound. Sleep apnea is categorized as a pure 100% blockage of the airway, whereby the patient stops breathing for a period of time during the night. The device that we use to help prevent snoring is called a Herbst sleep device, and it's a small mouthpiece that's inserted while you sleep, and it moves the jaw, the lower jaw, a few millimeters forward and pulls the muscles away from the airway, therefore giving the patient a continuous clear airway during their sleep so they can breathe better and therefore get better sleep. People who suffer from sleep apnea are typically have chronic fatigue. They're tired all the time. Sometimes they'll even fall asleep during meetings or even behind the wheel of a car. It can be a very dangerous condition. They're typically chronically grumpy, and they have a lack of energy, and therefore they are not as functional as they possibly could be at work or at home, as attentive as they could be to their spouse or their children. So if we can help solve a snoring or sleep apnea problem and the patient gets better rest, they will be happier, more functional at work and at home. Patients who are considered a severe sleep apneic patient, they would use a CPAP machine that actually forces the air, positive air pressure down their airway. Most patients who are diagnosed with a CPAP are not compliant. About 70% of all CPAP patients refuse to use a CPAP due to the discomfort of it, due to possible latex allergies, etc. So a smaller device that's easier to pack, carry, travel with, like a Herbst sleep device, is much easier and better tolerated by the patient, and therefore they tend to use it more and therefore get better airway, better sleep. The at-home sleep study is a very simple sleep study. You don't have to go to a clinic. It's a small device that you wear on your head while you sleep. It's very comfortable, and it records your breathing, your snoring, and if you have an apneic event, it records that. And you wear it over a period of 2 nights. And then we have a sleep doctor read those results and categorize the patient as severe sleep apnea, mild or moderate sleep apnea. And therefore, after that, we diagnose treatment remedies. If you believe you have a snoring or sleep apnea problem, please call us today and we can set you up with an at-home sleep study where we can help you treat your sleep apnea and snoring issues.